So I'll be doing our first talk this morning, which is I've titled Legislative and Human Rights Landscape in South Africa, Implications for Gender-Affirming Healthcare and Ethical Practice for Trans and Gender Diverse Children and Adolescents. And why I have specifically identified this particular topic area is directly linked to my journey in gender-affirming healthcare, and especially when I started finding myself being approached by parents of transgender and gender diverse children and adolescents asking me for support, both family support and as well as psychosocial support in relation to their child and the family. But we were then navigating the need to negotiate and explore the social transition journey of children and adolescents, and especially in the school environment, I found myself often confronted with questions and concerns, be it both anxieties on the part of parents as well as questions when we would be negotiating, especially in school environments, certain legal framed questions. So I found myself so the other disclaimer, so I'm not a lawyer, I'm not speaking as a lawyer. I am speaking as a psychosocial health practitioner who works very closely with families and transgender and gender diverse children and adolescents, both from the position of psychosocial support, but also as an advocate and as an ally. I found myself in spaces where I would be negotiating, with, for example, principals and school management, teams, etc. And I felt I needed to be versed with essentially what the legislative and human rights landscape is, especially in South Africa. And what I'm going to be presenting here today is I'm going to take you a little bit on a journey as I had to navigate various of the legislative and policy documents that we have and the laws that we have in South Africa that I needed to be able to rely on, draw on, and sometimes even cite and quote in my task as a psychosocial healthcare practitioner in supporting and advocating for my transgender children and adolescent clients and families. And part of my intention is, so how I've done this is, as you can see in the scope of the presentation, there are specific acts I'm going to take us on a bit of a journey through. And essentially how I've approached this is I've kind of done a desktop review, and I've essentially taken each of these legislative documents and I've just pulled out direct quotations from these legislative and policy documents that directly speaks to the arena and the context of gender affirming healthcare, as well as the rights of transgender and gender diverse persons holistically, but also in view of in relation to children. The overall kind of one of the summative points that hopefully will become clear to you is that even though our laws are not yet perfect, and no laws ever are, and there is still significant need for advancement, improvement, and further development of some of the laws in South Africa that needs to guide us as healthcare practitioners. The already existing legislative and policy landscape is already substantially in support of and actually is empowering of transgender and gender diverse persons, as well as children, adolescents, and their families. And I'm hoping that's going to be highlighted. So let's jump in and let's navigate. So I know dealing with legislation and policy is not always the most sexy of topics, but I do think this is critically important for us as healthcare practitioners, whether it's psychosocial or physical health practitioners, to understand the the existing legislative context, policy context, and I'm also going to speak to aspects of international standards of care and our ethical codes and international guidelines for practice that link into what the acts also articulate. So this is a little bit of a dive into the understanding of our policy and legislative landscape. So the first is our constitution, which we know in South Africa is our supreme law. And these are just some of the quotes that I've pulled out of the Constitution in the first chapter, the opening chapter of our Constitution. And here is some of what our Constitution articulates. So there's the belief that South Africa belongs to all who live in it, united in our diversity. So all who live in it means inclusive of our transgender and gender diverse citizens, be they children, adolescents, or adults, united in our diversity. And I just think it's critically important and profound that at the start of the Constitution, that the concept of diversity is centered and is emphasized in the opening part of and in the first chapter of our Constitution. Another important quote from chapter 1 is that the Constitution intends to establish a society based on democratic values where social justice, which is critically important, because where it comes to our work as healthcare practitioners in partnership with social society organizations as well as other non-for-profit organizations, where part of our role is to ensure social justice for all. And as Sakile alluded to, the transgender and gender diverse community and our transgender and gender diverse citizens are in particular still a minority group in South Africa who do still face a lot of social injustice. But it's a core principle of our Constitution. So to establish democratic values, social justice, and fundamental human rights, which will be unpacked in a moment. Another important point in the chapter 1, it says that the intention is to improve the quality of life of all citizens. And the quality of life concept also jumped out to me when I was reading this, in particular in relation to transgender and gender diverse persons. When I started out in this field, for example, medical aids would not, cover gender-affirming healthcare for transgender persons because they would say things like it is a lifestyle choice. But what we do know, and it's articulated, internationally, is that when it comes to gender-affirming healthcare for transgender and gender-diverse persons, it is a quality of life issue. And our Constitution, in the first chapter, emphasizes that it is the intention through the Constitution, and however the state and entities within South Africa function, is we need to be contributing to the quality of life of citizens, and quality of life is a critical issue for transgender and gender diverse children and adolescents and adults. And then to free the potential of each person. And what is important there as well, I'm getting some feedback. Can people put off their mics, please? And so it says also to free the potential of each person, and something that'll become very clear, both in relation to how we support transgender children and transgender adolescents, transgender and gender diverse children and adolescents, is the significant importance of making it possible for transgender and gender diverse children and adolescents to be able to live and express their true authentic selves. It is only when they get to live and express their true authentic selves that it is possible for them as an individual human being to move closer towards the freeing of their full potential as a person. And of course, human dignity and the achievement of equality is a core principle in our Constitution. And I can recall and mention many examples of the day-to-day lived experience of transgender and gender diverse children, adolescents, adults, be it in the school spaces, be it in public spaces, be it in workspaces, where because of the existing prejudices and ignorances that still exist in relation to fully understanding and being inclusive about transgender and gender diverse citizens, children, adolescents, and adults, the day-to-day experiences of impinging on the dignity of transgender and gender diverse persons that happens in so many spaces. But yet we have our constitution that as a core value centers the respecting and the valuing and the affirming of human dignity. And so these are also, constitutional principles that should be informing our understanding and our approach as healthcare practitioners. In the Bill of Rights, in part one, in chapter two, part one, here are some of the important citations. So the Bill of Rights enshrines the rights of all people in our country, and it affirms the democratic values of human dignity, equality, and freedom, which you'll see some of the principles and values being repeated, but I've included them each time so we can see that the emphasis of human dignity, equality, and freedom is permeated through all our legislation. The Bill of Rights applies all laws. Now that's really important. It applies to all laws and binds the legislature, executive, and judiciary, and all organs of state. So what is important is we need to understand that no law or any of the other legislation may run counter to what is articulated in the Bill of Rights. And this is also the basis on which many of the existing laws that still need to be developed and further improved so that it's better in being inclusive of and acknowledging of and ensuring the rights of transgender and gender diverse children, adolescents, and adults need to continue happening. Everyone is equal before the law, everyone, including transgender and gender diverse children, adolescents, and adults. The Bill of Rights also states that the state may not unfairly discriminate, and this is the part where all the various aspects of diversity are included. And I've just highlighted gender. And what is important for us to understand is that the way gender is articulated in our Constitution and in the Bill of Rights, the concept gender here includes transgender and gender diverse persons. And that's unpacked elsewhere in the literature extensively, but in particular, we'll be looking at the Alteration of Sex Description and Sex Status Act later, and there where we have a law that articulates that persons may go through a process where they need to alter and correct their gender marker through home affairs is a further articulation in the law, South African law, where it is understood that gender is inclusive of the entire gender spectrum, essentially. The other important citation is that no person may unfairly be discriminated directly or indirectly against anyone on one or more grounds in terms of subsection 3, but that the national legislation must be enacted to prevent or prohibit unfair discrimination. So I, as a psychosocial healthcare practitioner, and both as an advocate and an ally for my transgender and gender diverse learners or children and adolescents, I'm often able to draw on this particular emphasis here, where any practice that I'm confronted with, be it in a school environment, be it in other environments, I'm able to draw on our Constitution, on our Bill of Rights, and highlight that essentially if there's any activity or act that is prohibiting or discriminatory in relation to our transgender and gender diverse children and adolescents, that I can call on the authority of our Constitution. In part 2 of the Bill of Rights, there are some other important points I pulled out. It says everyone has inherent dignity and the right to have their dignity respected and protected. And I've already highlighted the importance of how dignity, especially in relation to transgender and gender diverse persons in their day-to-day lived experiences, find themselves in situations. Another example is, a transgender person or transgender learner in school who has socially transitioned, and a teacher that then during, when doing attendance calls out the child's, name that's made, for example, on their birth certificate, but it's not the name that they have claimed for themselves through social transition. Clients sitting in a waiting room at a hospital and having their dead name called out when they've already socially transitioned, and a trans woman has to stand up in a context where an obviously masculine name has been called. So, going to the bank and handing over your ID and being called out that your ID isn't matching the person that's standing in front of them. And there are many of these examples where on a day-to-day basis, transgender and gender diverse children, adolescents, and adults find themselves in situations where their dignity is being impinged. And we need to remember that the Bill of Rights enshrines that dignity must be respected and protected. Everyone has the right to bodily and psychological integrity. And this is also a critical point in relation to transgender and gender diverse persons. The right to bodily and psychological integrity. In the presentations that will come later, you're going to hear about, when it comes to transgender and gender diverse children, adolescents, and adults living their true selves, to various degrees, aspects of transition may then be what is needed. You'll hear about social transition. You may hear then about, gender affirming aspects of transition and surgery. So here the Bill of Rights enshrines the right to bodily and psychological integrity. And we know how critical it is for so many trans and gender diverse persons that part of their journey is being able to make the necessary social or the necessary transitions, be that socially and otherwise, so that they can live their authentic true selves in the world, both physically, emotionally, and psychologically. And our Constitution actually enshrines that principle. And the right to security and the control over their body. There's a lot of, there's a lot being said about the importance of a transgender and gender diverse person's right to self-determination, informed, consent, but the right to be able to make decisions over themselves and their body. And this is also enshrined in our Constitution. Everyone has the right to an environment that is not harmful to their health or well-being. And I think that I've kind of already alluded to. So in all spaces, and we know that still today, be it in their community, be it in their families, be it in school and other environments, transgender and gender diverse persons still face experiences and situations where they, may experience, threats to their lives, physical harm, psychological harm, social harm that influences their health and well-being. Everyone has the right to access to healthcare services, including transgender children and adolescents. This would be inclusive of. The Bill of Rights also says that the child's best interests are of paramount importance, and this is going to come up through a number of the laws that we're going to look at. But it's about the best interest of the child needs to be the guiding principle here, and this will be elucidated more. And that everyone has the right to a basic education. I do a lot of work, as I've alluded to, with supporting transgender learners together with their families to negotiate their social transitions, for example, in schools. But it's about creating safe spaces in school environments that is inclusive of transgender and gender diverse learners as well. And that needs to be done because they, like all other citizens and children, have the right to basic education. Then just having a look at the Children's Act, Act 38 of 2005. So here we again see the emphasis on that the best interests of a child are of paramount importance in every matter concerning the child. So when it comes to the best interest, we need to understand what is the existing evidence-based knowledge, expertise, in relation to understanding what is best in supporting and caring for transgender and gender diverse children, adolescents, and adults. And if you're going to act in the best interest of a child, you have to be drawing from what the existing best practices, evidence-based literature and research is, and that should be informing how we are supporting our transgender and gender diverse children and learners, because the Constitution and the Children's Act and the Constitution says that all actions in relation to children must be guided by the best interest of the child principle. We need to make provision for structure, services, and means for the promoting and monitoring the sound, physical, psychological, intellectual, emotional, and social development of children. So any practices, any experiences that are happening in the lived experience of especially children and adolescents that is not promotive of their physical, psychological, intellectual, emotional, and social well-being is essentially counter the Children's Act and would empower us as healthcare practitioners to then act from this principle. The Children's Act also highlights that we need to protect children from discrimination, exploitation, and any other physical, emotional, or moral harms or hazards. And I've already kind of been articulating and referring to what the lived experiences on a day-to-day basis may be. So our Children's Act empowers us to act in ways that we counter and we challenge any context situations that further the discrimination, exploitation, and causing harm of children. The Act also says that we need to promote the protection, development, and well-being of children. And of course, these are all children, including transgender and gender diverse children. And the child's best interest is of paramount importance. I just highlighted just to show that this does feature quite regularly throughout most of our legislation, and especially in the legislation that speaks to the interests of children and adolescents. Then just another point from the Children's Act. It says every child has the right to have access to information on health promotion and the prevention and treatment of ill health. And what is informing that information? Again, we have to be drawing from what is the latest evidence-based literature, research that informs best practice guidelines with regards to how best act in assisting and supporting transgender and gender diverse children as it would be applied to all children. Also, before a person this is another important point here, before a person holding parental responsibilities and rights in respect of a child takes any decision involving the child, that person must give due consideration to any views and wishes expressed by the child, bearing in mind the child's age, maturity, and stage of development. Why I've highlighted this is that our Children's Act actually centers the voice of the child. It starts to articulate that what the child expresses needs to be acknowledged and needs to be respected. And especially in relation to transgender and gender diverse children, where we have children as young as age 3, 4, or 5 already articulating and expressing that their lived experience of their gender is not matching the gender they were assigned at birth. Our Children's Act actually centers that we have to factor in and listen to and respect and value the voices of our children. I'm going to just, there's more here that you can read, but I think you're starting to get the gist. Just to say here that it says that a child, if a child is over the age of 12, so with regards to medical treatment and consent, it also, the Children's Act says or includes that as early as the age of 12, children may also be engaged in, informed consent around certain medical and other treatments, and that needs to be understood and appreciated. Our National Health Act, another important act, in the preamble, it says that we need to establish a health system based on decentralized management, the principles of equity, and here, very importantly, based on things that have happened in the last year, so internationally recognized standards of research. and internationally recognized standards of research. We'll hear about WPATH in a moment. And again, this alludes to that our law says that whatever treatment or healthcare support is given, it has to be based on internationally recognized standards of research. So this means things like so-called reparative therapy and corrective therapies, which have internationally been denounced and actually been deemed unethical, would absolutely be unacceptable in any form of healthcare, offered to transgender children, adolescents, and adults, of course, as well. Our National Health Act says we need to establish a national health system that provides in an equitable manner the population of South Africa the best possible health services, which means we have to be informed by research-based, evidence-based best practice, fulfilling the rights of the people of South Africa to an environment that is not harmful to their well-being or health. The Director General must, in accordance to the National Health Policy, liaise with national health departments in other countries and with international agencies. And I thought that was critical that our National Health Act includes this, because presently, for example, the international standards put out by the World Professional Association of Transgender Health are the recognized international standards when it comes to gender-affirming healthcare for children, adolescents, and adults. And our law actually includes that we need to be in alignment with international standards. And if we do develop standards for South Africa, we cannot develop standards or practices that run counter to what is also the internationally recognized practices. Just to say, in our Mental Health Care Act, when we talk about mental health in South Africa, mental health is inclusive of both physical, mental, and social well-being. That is the inclusive definition. The Act requires the provision of mental health care services in a manner which promotes the maximum mental well-being of users, including transgender and gender diverse children and adolescents. In the objectives of the Act, it says the best possible mental health care, treatment, and rehabilitation services available to the population equitably, efficiently, and in the best interests of mental health care users should be the objectives of all care, and should be the position we are working from as healthcare practitioners. The implementation must promote the rights and interests of mental health care users. Every mental health care user must be provided with care, treatment, and rehabilitation services that improve the mental capacity of the user to develop to their full potential and to facilitate his or her integration into community health. And so much of what gender-affirming healthcare is about, and supporting transgender and gender diverse persons to go through whatever transition steps they need to go through to do so, but also so that they can live their true, authentic selves, and both within themselves and within their communities and within their families is critical. And our Mental Health Care Act in particular highlights that is required of us to promote as healthcare practitioners. Every mental health care user must receive care, treatment, and rehabilitation services according to standards equivalent to those applicable to any other healthcare user. And there we know that basically alludes to the fact that all healthcare intervention must be based on contemporary evidence-based research and best practices as recognized within particular disciplines internationally as well. Our Schools Act, just as a short note I've included there, in all schools should provide an education of progressively high quality for all learners, which includes transgender and gender diverse learners. And in so doing, lay a strong foundation for the development of all people's talents, capabilities, advance the democratic transformation of society, combat racism and sexism, and all other forms of unfair discrimination, which sadly many of our transgender and gender diverse children in many school spaces are still facing. And it is our role and function as healthcare practitioners from our various positions to be addressing this, so that in the end, to uphold the rights of all learners, parents, and educators. I'm not going to go into too much detail here, but we have the Alteration of Sex Description and Sex Status Act, which essentially is the act that in South Africa recognizes that transgender and gender diverse persons exist. People go through process of transition that may require them to then have their birth register corrected to reflect the gender that the person identifies with. This is an act that's in the process of being looked at, being improved so that it's not just binary in relation to identifying as male and female, but we already have an act that recognizes that transgender or gender identity is on a spectrum, and that for some reasons, for some citizens, it may need to be changed, and the law allows it to be changed. I see my time's almost running out. Just to say that the Western Cape Education Department and the National Department of Education is in a process of looking at developing a policy guideline for schools. But this is not yet completed, has been the source of a lot of controversy. But there's presently a draft guideline that exists for the Western Cape Education Department titled Guidelines on Gender Identity and Sexual Orientation in public schools of the Western Cape Education Department. And there's also work being done to try and also make this a national policy. It's not yet in existence, but I think it's important for us as healthcare practitioners to be aware of this. So the law says we need to draw on international standards of care, or we need to recognize international-based, evidence-based research, and we need to know as healthcare practitioners that international standards of care already exist. We have the World Professional Association for Transgender Health Standards of Care, presently in version 7. Version 8 is in process of being developed. There is a child chapter working group that's also looking at the further development and updating of the WPATH standards of care, where here it says there's a significant move towards far more affirming philosophies of care in relation to children. There's also the International Endocrine Society that has clinical practice guidelines when it comes to gender-affirming care hormone treatment. Guys, we all are members of healthcare professional bodies that holds us to account for our codes of conduct and for ethical practice. And just what I want to pull out here that links to the legislation for us as healthcare practitioners, we are all held to working from evidence-based practice. We are all held to the requirement to follow best practice guidelines. We are all required to ensure that we're involved in continued professional development while you are here today, to work within our professional scope of practice, and that we can be sanctioned for non-compliance. And that across most of the healthcare professionals, within our various ethical values and principles, it all articulates things along the lines of that we need to ensure social justice. We must first do no harm. We must respect people's worth, human rights, and dignity. We need to respect the right to self-determination of our clients and patients. We need to be professionally competent, work from a place of integrity, be professionally responsible, and work from a care and concern for the well-being of our clients and patients. And so various international healthcare professional bodies also articulate these basic principles, codes of conduct and ethics that we as healthcare practitioners are held to fulfill. What is then also helpful to know for those that are kind of navigating this field for the first time. So yes, our law says, okay, we need to recognize, best practices and international, standards. Do these exist? And yes, they are already. This is not meant to be exhaustive, but for example, in South Africa, SAISA, our Psychological Society of South Africa, have put out practice guidelines for psychology professionals, but are as applicable to other professionals working with sexually and gender diverse persons. There's guidelines for gender-affirming healthcare for gender diverse and transgender children, young people, and adults. That was from New Zealand. The US has guidelines, Australia has guidelines, Canada has guidelines. So we need to know that already various guidelines exist. There are also professional associations for transgender health that we as healthcare practitioners can look towards for guidance in relation to best practices and to make sure that we're accessing the latest, evidence-based research and practice guidelines. So you're joining us today. We are the Professional Association for Transgender Health South Africa, but there are many associations internationally. There's the Transgender Professional Association for Transgender Health, the United States Professional Association, the European Professional Association in New Zealand, as well as in Australia, and there may be more. This is just to give you a snapshot that these associations internationally and locally already exist that we can link to and draw from. And that brings me to the conclusion of my presentation. Thank you. That probably felt a bit like a runaway train. And yeah, I hope I made sense and I was coherent.